Dr. Alba Raphaela is with us here today. Good afternoon.
Hi, how are you doing today?
I'm doing great today. Now, you've got a new book called Breaking the Mirror, the story and guide on how to recognise and deal with a narcissist. So is it pretty self-explanatory what the content of that book is?
Right. Yep. Yeah. So I'm a clinical psychologist, and I was married to someone who had narcissistic personality disorder.
Oh.
So I figured I would write a book about my experience from both a psychologist perspective and as an ex-wife.
Yeah.
So,
And the title of it being Breaking the Mirror, what exactly does that mean?
yeah, good question. So what that means is when we are in a relationship, specifically, a romantic one with a narcissist, we try really hard to live in the image of that person. And we kind of create like this false self, this idealized self that the other person wants us to be.
Yeah.
And when I left the relationship, it's this metaphor for breaking the mirror. I'm breaking the mirror of the image that he conceived of for me and created a new mirror, basically, a new image of myself.
Yeah. And how would you actually define a narcissist? Because I've always thought, and probably most people, have just associated it with somebody that fancies themselves and thinks they're amazing. But is there more to it, a kind of controlling nature in there as well and things?
Yeah, so we use the term very loosely, in society, especially with social media, like someone who's just vain or selfish or self-absorbed. And for a clinical diagnosis, there has to be specific criteria. So typically, these individuals are grandiose, they're know-it-all, they're very manipulative, they have tactics to project their feelings onto other people. They have responses that are, like temper tantrums, basically, over seemingly small things. So there's an unstable mood. And at the end of the day, it always comes out to be about them in some way, them being in a positive light. They're better than everybody else. They're smarter than everybody else. It's us against the world. And they build you up on this pedestal, and then, they knock you back down, and they're very emotionally manipulative. There's different types. There's vindictive types or bullying, aggressive types. But yeah, there's a piece of that. There's a piece of they're self-absorbed and they fancy themselves. Like
And how does it all work? Because that sounds like they've put a lot of thought into it and sort of planned it out. Is it like that? Or is it sort of subconscious and they just have this personality and aren't really thinking about it?
Right. It's actually, it's not planned. There's a genetic component. It's a personality disorder, meaning that it's never going to be cured or go away. They often have very poor insight into themselves, and they really don't go to therapy because they don't think they have a problem. They think everybody else is the problem. And it's a longstanding pattern of behaviors. They have interpersonal difficulty. They can be seen as arrogant or haughty, entitled. So oftentimes it's not even conscious on their end because that's their reality, that's their world of being this way.
Yeah. And do you know what causes somebody to be a narcissist? Are they just like that from birth, or could it be perhaps childhood experiences?
Well, typically in the world of psychology, we look at things as nature and nurture. We do see it threaded in families for personality disorders, and oftentimes in order for narcissism to develop, there has to be something in childhood that occurred. Now, it could be an actual trauma in childhood, or it could be a perceived trauma that a kid has. Sometimes the parents overindulge that child and they spoil them, and they're the Prince Charming and the golden child. So that can also create a narcissistic personality disorder. But oftentimes it could just be real or imagined trauma or abandonment even. I don't even mean like a physical abuse or anything. So all of that together, plus that child's experiences in the world, helps culminate the disorder.
Yeah. And I think you mentioned quite briefly that you're not able to unbecome, if that's a word, a narcissist. But are there ways to sort of suppress it? And maybe if you are married to one or just know one, are there ways for you to tone them down a bit?
Well, being in a relationship with one, it kind of depends. Like there's usually a lot of boundary setting that needs to occur, not trying to please this other person and becoming too codependent. Depending on, if it's aggressive or violent, oftentimes people end up getting, like leaving them or getting a restraining order on them or having to to block them on social media just because the other person doesn't like to be abandoned.
Yeah.
If it's a boss, you can, set boundaries, you can quit your job, you can cut off a friendship. But oftentimes when I work with people who are dating or married to a narcissist, they really have to come to a realization that this is pathological. Person isn't going to be different.
Yeah.
You accept that. Want to stay with this person, this is what you're going to have to do to protect yourself. The biggest key is not responding when they fly into a fit or rage. Just sitting there and gray rocking, we call it, just being quiet, just letting it happen and not engaging, because you're not going to win. You're not going to win that.
Yeah, that's the best solution in a lot of arguments, actually, because then
right.
you never encourage them.
No, you just go round and round and round, and they wear you down, because oftentimes these individuals are very intelligent and very charming and seductive, and they wear you down to the point of exhaustion where you just throw in the towel at that point.
Yeah. And are there narcissists that realize they're a narcissist and try and get help?
Rarely. There is a kind of therapy that was created specifically for personality disorders called schema therapy. And there are people who do engage in therapy. I would say it's way less frequent than people who have insight into depression or anxiety that they have. So sometimes, I don't want to say like all or never, but sometimes they can, and mostly, there's not going to change. They just learn maybe to deal with their tendencies.
Yeah. And maybe, I don't know, there might be somebody listening to this right now realizing, hang on a minute, I think I might be a narcissist. What kind of advice would you have for them?
Well, usually they have to get accurately diagnosed, go see a psychologist. Psychologists usually have more experience in diagnosing than someone who maybe has a master's level degree, although they can as well. And really just, kind of like getting through the denial of it. Or don't read the internet, don't read a WebMD, asking friends or family about, how they honestly see this person. There are a lot of books on it, but usually they're written for the friends, family members, or the spouse of the narcissist. But definitely getting help for it, because there are ways to help manage the mood swings and relationships as well.
Yeah, definitely. How exactly does your book help us deal with a narcissist? Does it have certain tactics that you're able to share?
Yeah, I kind of integrate my story, my life story with him, and also clinical, way in order to recognize, see the red flags, and have some maneuvers and tactics to deal with a narcissist. And most of the time, it really is setting a lot of firm boundaries, like physically leaving the house or just physically getting away. And a lot of it is really just not internalizing what this person believes about you. So you may not necessarily have to leave, but ways to change your own thinking about yourself and that person. So my book highlights that, and also, like I said, intertwines my story.
Yeah, definitely. And how long did this book take you to write?
It felt like it took forever, but it was about 6 months. It didn't really take me too long, because once I started just kind of writing, it was very healing for me. And I just was able to let the story just flow. And I had always wanted to write a book. I just wasn't sure what I had wanted to write. And I was journaling, like I normally will journal. I tell my patients to do these things, so I try to do them as well. And it just kind of emerged into a book. I kind of felt like I wanted people to hear my story. Yeah. And the fact that I'm a psychologist, still was in a relationship for 27 years with this person, it can happen to any of us, even us in the field. And there's no, shame with that. And recognizing that there's a light at the end of the tunnel.
Yeah. And has this pandemic perhaps helped you have a little bit more time to write the book, given that we haven't really been allowed to do much other than stay at home?
Yeah, I think so. It was... I'm still seeing patients in person, so telehealth in my practice, but it definitely gave me a lot of time. Plus, I left him during the pandemic, so all of this is really fresh in mine. And I was able to really just have time to myself to be able to process all these feelings and work through it on my own, in addition to support from friends and family. So I think, all of it, the timing really helped. I was honestly not thinking it would be so quick, but the book writing company that I was using, we just had to flow, where I just gave them pages every single week, and they edited it as we went along. And they, helped me be accountable every week.
Yeah, and that's a good point, because there's been a lot of people probably that have been locked down during this pandemic with a narcissist, and there's not really many ways they can escape.
Yeah, absolutely. No ways to escape, especially in the beginning of the pandemic, just being locked in the house and not being, you can go for a car ride maybe, but so it's definitely been challenging, even for a lot of patients I see that are dating or in a relationship with a narcissist, or even it might be their own child. It could be their parent, it could be their child. And it kind of helped in a way too, if they weren't living in the house with that person, that they don't have to now go see their narcissistic dad or mom because of the pandemic. There's a physical boundary that was already inherent in that.
Yeah, that's also a good point. And you mentioned children there. Is it quite common to notice narcissistic children? Because I guess the stereotypical think they're amazing thing is kind of almost normal in a lot of children, naturally, isn't it?
Yeah, it is. So that's why a personality disorder such as narcissism cannot be diagnosed until someone's 18, because kids inherently are self-absorbed and grandiose and entitled, this generation, this Gen Z generation. So we have to wait, and we can see it emerging, but diagnostic have to wait till they're 18, because we have to see, is this a phase? And then they come out of adolescence and they reset.
And what is your ultimate goal with this book?
Well, I dedicated the book to my son. He is too young to, read it now, but I mean, eventually I would love for him to kind of read it or see my side of things. But I just want to help people. I already do that in my profession, and I felt like it was, an honest memoir that I'm able to share with people, not just say, hey, this is what I know about it from professional experience. And I would hint at it. I would say, well, personally, I know, but I just think that hearing my story can help people to make some changes in their life, maybe seek some help, or just feel a sense of normalcy, that they're not alone with these types of toxic relationships.
Yeah, and there's probably not many people better qualified to write this book, because you have the experience and you're a psychologist, so you've got both the things that you need, really. I
was thinking that, yeah, and when I was looking to see what was out there, because I've read a lot of books myself once, and that's kind of how I realized what was going on in my life, was, written by psychologists about cases, or written about, maybe people that they knew, but they didn't really name, or they were written by people who were non-psychologists and their marriage or their relationship. So I just thought that it was unique, kind of blending the both for credibility purposes.
Yeah, absolutely. And what's it like to actually write a book about a personal experience? Do you find it quite challenging, or maybe a bit cathartic?
Both. Yeah. Honestly, I went through phases of it where it was initially pretty cathartic, and then it was really challenging. And when I published it, because it wasn't that long ago that we published it on Barnes & Noble and Amazon and digital formats, it was really exciting, but also super scary, because I felt so vulnerable. Like, my story is out there. And there were nights when it was really challenging, where I was triggered, by reliving it, memories of what it was like being married to this person. So it was definitely a combination, but I still think at the end it was worth it.
Yeah, absolutely. And are you planning to write more books after this?
I thought of it. We're going to see how this one does. But yeah, it could be a part 2 of this. It could be other books, in the field. So I would like to, now that I'm technically a published author, I would like to.
And I guess are there other psychology topics that you would be quite interested in writing about?
There's so many, and I think that's what I was hung up on for so long, was I don't know what to write about. I feel like I know so many topics that I've dived into and been interested in. I just didn't know where to start. So this was definitely a springboard for that. So I would like to write other books as well.
Yeah, absolutely. But in the meantime, where are we able to check out this book if we'd like to have a little read of it?
So we're just beginning my marketing campaign, and my website will be up soon. It'll be probably live next week, albaraphaela.com, sorry. And it is published on Amazon and Barnes and Noble, and it is available on lots of different digital formats as well.
Yeah.
So no Audible book yet, but those are the main places that people are finding them. I think they'll be in bookstores as well. So that'll be cool.
Yeah, it'd be good to have an audiobook that's read by somebody that loves the sound of their own voice. That would be quite ironic.
Right, yeah. Getting somebody to read it or read it that's a narcissist that likes to sound their own voice.
Yeah. Well, thanks very much for joining us here today. It's been great talking to you.
Oh, you're welcome. Thank you.